We're honored to be sitting here today on Dr. Saying Stuff. Today, we're chatting about endometriosis, something that neither one of us know much about.
Endometriosis is a chronic medical condition where tissue that looks a lot like the tissue that normally grows inside of the uterus, called endometrial tissue, grows outside of the uterus and causes lots of inflammation. So the most common symptoms are pain with periods, pain with sex, but also because endometriosis typically grows near the bowel and the rectum, can also cause a lot of bowel issues. Endometriosis affects a lot of people, up to 10% of those who are assigned female at birth, and there are people of all races, ethnicities who are affected by it. It does tend to have a higher risk if you have a family history of it, meaning that if a relative of yours, your mom, your sister, has endometriosis, you have a higher chance of having it. Also, if you had an earlier age at which your periods started, what we call the age of menarche. It can take a very long time for someone to get diagnosed with endometriosis. In fact, on average, it takes 7 years from the time someone starts having symptoms to the time they're diagnosed. And there's a couple of reasons for that. One is that endometriosis is diagnosed with surgery. It actually doesn't tend to show up on imaging studies or even on exam. So a lot of times people having all this pain will go to an emergency room, they'll get an ultrasound, a CAT scan, and they will look perfectly normal. Because we can't see it on imaging, we actually have to see it with our eyes in the body, and we do that with laparoscopic surgery. That's where we put small incisions in the abdomen, we fill the abdomen with gas so we can see, and we put a camera in, and we look all around the entire abdomen and pelvis, and anything that looks like endometriosis, we cut out. It's called excision of endometriosis. And then we send that specimen to a pathologist. They say, yes, under the microscope, that's endometrial type tissue, and that's how you get your diagnosis, plus that's the treatment. Medications like hormonal birth control, pills, the ring, the patch, Depo, an IUD, the next one on, all of those can help lighten periods and decrease endometriosis symptoms of pain and inflammation. A lot of times, if someone is young, doctors may be reluctant to, take someone for surgery. But a lot of us who are endometriosis specialists, do say, please, if you're having pain and you're not getting answers, think about endometriosis and consider a laparoscopy so you can get an earlier diagnosis.
We really appreciate you being here. Thanks for joining Dr. Saying Stuff, where we not only say stuff, but we speak health.